So good morning, welcome. As I said, my name's Olivia. I am a qualified dentist and I work as a clinical fellow for HCIW. Thank you so much for attending. The aim of today really is to raise awareness of the unique career opportunities that exist within dentistry and in the dental team in Wales, and to help you prepare for any kind of university applications that you may be making to become a member of the dental team. So this morning's event will also tie in with the launch of our Dental Careersville building, which is launching today. And this is on our virtual platform. I'd encourage you to take a look. It includes a lot of content on all the roles available in dentistry, so dental technicians, dental nurses, dental hygienists, therapists, even orthodontic therapists, and of course dentists. So now it's time for me to introduce our panel members. So these are dental professionals who work across Wales, and we're really pleased to have them with us. So if we could just start, if we could just introduce you guys, tell us your name, your role, and where you work at the moment. So we'll start with Catherine, please.
Good morning, everybody. My name is Catherine Marshall. I'm a dental nurse, and at the moment I work for Health Education and Improvement Wales.
Fantastic. Thank you. And Fiona.
Hi, good morning. My name's Fiona Sandham. I'm a dental therapist and I'm currently working in an NHS practice in North Wales.
Great, thank you. And Meryl.
Good morning, everybody. My name's Meryl Spencer and I'm a consultant orthodontist based in Morriston Hospital in Swansea.
Thank you, Meryl. And Chet.
Hiya, good morning everyone. My name's Chet Geisel. I'm a lecturer in dental technology at Cardiff Metropolitan University.
Fab. Thank you very much. Welcome all. So we're going to start off with a question for everyone, really. So could you describe what a typical clinical working day looks like for you? So we'll start with Meryl, please.
Okay, so I work within the hospital service, so I do a mix of a lot of clinical and admin and support and professional activities. But my clinical day would probably involve arriving quite early, going through a lot of letters that I need to sign, maybe looking at some referrals that I need to grade. And then I normally do a clinical session in the morning, which lasts between 9 and 12:30. And as a consultant in the hospital service, because I supervise therapists and orthodontic trainees, I normally do see new patients and reviews while I supervise the other guys, members of the team, doing some clinical orthodontics, some more paperwork over lunch, and then a similar clinical session in the afternoon, which also may involve joint clinics with restorative consultant colleagues or maxillofacial consultant colleagues.
Okay, fantastic. Thank you, Meryl. It's quite a varied role. I should have just said before, if you have any questions, thank you. We've already had a few questions in, and thank you to those who emailed questions in. If you do have any more questions from the presentations that we've heard already, or for our panel members, if you just want to type them in the chat, that'd be great. So we have had a question. Thank you very much. For students applying for dentistry or associated roles, what expectations do admissions tutors have for relevant clinical work experience? Thank you. I'd say that's probably been close to being answered in a couple of in the presentations earlier. I don't know if anyone wants to take that question. We've kind of answered it in the presentations, but does anyone want to give a brief answer?
I think you're right, Olivia. I think it's probably been covered.
Yeah.
It is quite difficult to get work experience, but I think, like you said earlier, it's a matter of contacting as many people as you can and then hoping that one of those people can provide it for you. I know within the hospital, we do take people for work experience. You have to contact us. You can contact a member of the team, but at the moment, Morriston's not offering work experience because of COVID. But that might change in the future, although at the moment with cases rising, it probably won't. But we have to then fulfil a quite robust process to allow people to come into the hospital. So a lot of form filling, but then you do get feedback and a documentation that you can fill in to say you've spent time with us.
Thank you, Meryl. Yeah, I think I would start off. The presentations are recorded, so they'll go on the Careersville platform, so you can listen back. But I would start off with contacting your own dentist. I think you probably have more luck in the kind of primary care setting in general dental practices, because they're much kind of smaller units. A hospital there's a lot of people working there, there's a lot of processes. But if you could get a hospital on your kind of CV for applying to dental school, it would be brilliant if you could. So I would try and exhaust every avenue possible. I think what we'll do is we'll just go to the questions that I've got here, just because they've been kind of submitted ahead of time, and then I will go back to the chat and we will try and get through all the questions. If you want to type your questions in the chat, that'd be great. So we'll just go back to describe what a typical clinical working day looks like for you. So we'll go to Chet, please.
So I'll cover it from my perspective currently, but I think more relevant would be a practicing dental technician. And the reason I say that is because I'm currently lecturing. So my working day would be most teaching days is essentially spending time in the laboratory with students. So we teach a lot of hours. So if you're coming in to study dental technology, you can expect lots and lots of time in the labs doing hands-on practical work. But as a dental technician, the sort of the normal day-to-day life would be, you get in fairly early, it's pouring models, and then it's working at the bench. It's depending on the discipline that you go into, and in dental technology, we tend to specialize in the certain disciplines. So Olivia covered crowns and bridges, and Meryl works in orthodontics, and then we also have denture. So dental technicians would specify in one of those three areas, and you're spending time at the bench working on individual patient cases, manufacturing those particular pieces, and they differ in terms of the materials that you're using, the techniques that you use, but there are lots and lots of similarities across the three. And of course, on the course that I teach in, we cover all of those three discipline areas. Moving into sort of 2022, 23, as we sort of develop, there's lots of CAD/CAM coming in as well, and this is a really interesting part. We're teaching CAD/CAM quite a lot now. CAD/CAM is the computer-aided design aspect in dental technology, and there's lots and lots of new sort of technologies coming in. So your traditional your day-to-day life might be different in 10 years' time to what we're doing now. It might be working more with computers, but essentially it's going through the design process. So currently, most dental technicians would be working at the bench, working with hands, working with hand tools, working with wax and false teeth to make dentures, and going through each patient case individually. So it's a very, very hands-on job. We don't use the word clinical there, Olivia. We don't necessarily work clinically per se. So the dental lab is often detached from the clinic. We don't deal with the patient directly, as it were. We have patient models and other records and information that we get from the patient, from the clinic, but we're manufacturing them sort of independently of the patient. So it's a very hands-on, very arty, very kind of technical side of dentistry that isn't often seen. When you go into a practice, you don't necessarily see the dental technician. So
yeah, I'd agree, and I think we'd really like to kind of raise awareness of the different roles in dentistry. I think a lot of people just think they go and have their teeth cleaned, there's the hygienist, the dentist, but actually there's so many more people behind the scenes, and there's a variety of roles, and there's huge scope there. So thank you. So the same question, what does a typical clinical working day look like for a dental nurse, Catherine?
Oh, thanks, Olivia. So Meryl said earlier she'd get in early. I'd be there before Meryl because the dental nurse is usually there before the dentist. And one of the reasons is it's all about preparation as a dental nurse. So I'd get to the surgery earlier, may involve opening up the surgery if you're first in. And then probably when the dentist gets there, looking at your list of patients for the day, having a look, seeing who's coming in. Is there anybody that's nervous? Look out for that sort of thing. Maybe if we're treating some children later in the day, make sure you've got enough, maybe something to distract them while they hop into the chair. I'd be making sure the surgery was clean and safe environment for everybody to come in. And really, as I say, working with the dentist, I think, to make sure that you're prepared in advance. Have you got all your x-rays for the patients, perhaps some test results back, making sure so that when the patient does get into the surgery, that everything is ready so that you can start looking after them straight away. and then probably putting the kettle on before the day starts in earnest, I think. Always a good idea.
Fab. Yeah, I think a dentalist is, I always think it's about anticipation. You've got to anticipate every possible situation that could happen for that patient and be kind of prepared and organised for that. So fab. Thank you, Catherine. And last but certainly not least, Fiona.
Yeah, so again, I think we all like to be a little bit early into work. So yeah, I'd probably be in just after Catherine. And my first thing is to just chat. I always chat with the dental team because I only work here 1 day a week to catch up with everything that goes on because we're very much a team here. And then I will probably get changed into my scrubs and then go and look at the computer, look at my day list, look at what patients have got coming in, probably chat through a few of the patients with my nurse because I see quite a lot of children. And we're seeing a lot of children. It's really important that we sort of have the patter down to a sort of T. So we have a chat. Anything that's awkward is always highlight, your favourite patients and sort of look forward to them coming in. And yeah, just go through the list. And then we start at 9 o'clock seeing patients. So my day list today. So far, I've done 1 filling and 1 cleaning of someone's teeth, and then immediately after, I've got to do another filling, and I've got fluoride application to do, and yeah, just a load of different things, and everything within my scope of practice. So the dentist refers all the treatment that I can do, and then they will do the more complex treatment after I finish my course. So yeah, it looks like that really.
Thanks, Fiona. I think it's really important that we highlight that as a dental therapist, you are very much in charge of your list. You have your own surgery. It's there's so many things you can do as a dental therapist, and also the hygienist as well can do lots of things as well. So that's great. Thank you. I'm just going to go back to the chat, if that's okay. So we've had a question from Sumra. If you're unable to secure a place for dental hygiene and therapy, is it possible to apply through clearing after results day, as only certain courses go through clearing? This is a tricky question. In all honesty, I don't know the answer to that. That would be a question for somebody who works at a dental school, so the dental school in Cardiff, perhaps. Do any of our panelists know the answer to this?
Yeah, I kind of know the answer. Currently, the applications are very heavily subscribed, as it's been mentioned before, and normally we'll take a reserve list. So generally, we don't go through clearing. That's the perspective at Bangor University anyway. So they've taken their 12 students and they have some in reserve. And if people, don't make the grades or whatever, they have got the reserve list. So generally, we don't go through clearing because of the
because we don't really need to. Okay, thank you very much. That's helpful. Hopefully that answers your question. We also have another question. If not clinical, what else would panelists recommend? I'm not quite sure. Is this question referring to the earlier question about non-clinical work experience or non-clinical role? Are you talking about technology? Are you talking about being a dental technician? I'm not quite sure. Let's see what else you. Okay. Yeah, if you want to clarify, so I think if you want non-clinical work experience, either in a dental technician's office, Chet, what do you think of that for work experience to be a technician?
Yeah, I would really, really, really highly recommend anyone who's interested in dental technology would really benefit from getting into a lab if you can. Dental technicians, I put a brief sort of answer there. Dental technicians are the most sort of non-clinical, I guess, of the dental professionals, in the sense that, as I said, we don't deal with patients necessarily directly. We do sometimes deal with patients for denture repairs and sometimes for shade taking. So there are occasions when we do interact with patients, but our main role and scope of practice is working, at the dental bench in the dental laboratory. Work experience is a fantastic way to see exactly what it is that we do. And for people who are interested, I'd say Google local dental laboratories to yourself, get on the phone, go and knock on the door. Most dental laboratories, I would say, 9.5 out of 10 would be really keen to take people on. The industry's really crying out for people at the minute. We need lots of dental technicians all around the country, in Wales specifically, and there are labs in not every village, but there are labs in every big city, certainly. So really get out there and get to see what it's about. But yes, we are, I'd say, the most non-clinical. Clinical dental technicians is a fairly newish role, I think, to the GDC. There are far fewer of them. As I said, we need them, and we need people in dental technology. Clinical dental technology needs people too. These are dental technicians who do deal with patients and can can fabricate dentures directly with the patient, but it's focused within the denture discipline. I referred to 3 disciplines earlier. But yes, dental technology, the least clinical, as it were.
Thank you. I hope that's answered the question. If it hasn't, just type back into the chat bar and we'll try and help you further. So just moving on, we've had a couple more questions on email. This question is, what is the best thing about your job? So we will go to Meryl, please.
It's really difficult to answer that.
Too many to choose from.
I think when I started dentistry, I had no idea really what the options that were available, but we'll talk about that a bit later on. But for me, I think it's working in my team, who are fantastic. Involve all the people that we've got in front of us. I know in Morriston, I often get the technicians in if I think, oh gosh, I don't quite know how to design this. Can you come and help me? So we've got a lovely relationship. We have orthodontic therapists who are great. Really, the dental nurse is so supportive. So that is lovely, being part of a really close team. And I know it's a cliche, but helping people, I see patients transformed really in terms of their confidence before and after they've had treatment. We tend to treat in the hospital the most complex multidisciplinary cases, patients with teeth stuck in the gum, dentofacial deformities, and to see patients at the end of treatments when they're happy and everything comes together is fantastic. I do say to people, I think I need to get out more because I still get excited when they are pleased at the end of treatment. So that for me, I think, is the best part of the job.
Good. Yeah, I agree. I think dentistry is such a kind of creative thing, and we talk about kind of the need for manual dexterity, but the overall thing of dentistry is that we're helping people, and in every single role in dentistry you can help people. It's not just in hospital with the orthodontic cases, but in general practice, people who have gum disease and things like that, you can really turn people's lives around. I've seen it in practice, so I think it's a real positive of the career pathway. So we'll ask the same question to Fiona, please. What is the best thing about your job?
I think, well, obviously, being able to help people, delivering dental care, empowering them to take control of their own oral health as well is really, really quite a nice thing to sort of, especially if you have somebody that's coming that's quite young and you've given them some treatment, but also empowered their parent to look after their teeth, and then you know that you're saving them for a lifetime of treatment. So that's really nice. But I really love working as part of a team. I love coming in on a Wednesday and seeing everybody and just know that we're all sort of pulling together. We're really lucky here. So we'll swap patients if someone's running late or they've got an extra patient. We'll help each other out in terms of that as well. So I really like that in terms of my clinical days. But the other thing about dental therapy, like all the dental professions really, is that you can go and diversify as well. So, we joke about having lots of hats, but, there's lots of things you can go and do. You can go into education, you can go into marketing, you can go into into a special area. You can do loads of different things. So, it's about that diversity as your career progresses as well. So you might start off in dental therapy, particularly working in a couple of practices, but as your career grows and you grow confidence and experience, you can expand it in so many other ways. So it's not just sitting in a surgery 5 days a week. There's lots of other things you can do.
Thank you. Okay, the next question. Why would you recommend dentistry as a career? So a career as a dental professional, why would you recommend that? And I'll ask Catherine.
I definitely recommend it because I've made it a career for 40 odd years. So it's like, like Fiona was saying earlier, whatever part of the dental team you are, you can diversify and specialise in so many different areas. So I started my training in a hospital in Cardiff years and years ago, and then I went into general practice, and then I went into a hospital, back into a hospital, and then I went into education. So I think it really is, when people say, oh, I hate going to the dentist, or you're a dental nurse, you're that person with the section, it's so much more than that. So the reason I would recommend it is that it feels like quite a narrow environment, so perhaps just a bit of medicine. It's not, it's a massive different profession. So no matter what you think you want to do, you could be in a mobile dental unit going around different villages in Wales, helping people improve their own healthcare, or you could be in a hospital, in a theatre, assisting with some of the things that Meryl's talking about. I think really because it's the gift that keeps on giving. It's a really, really good opportunity to do just about whatever you can think of in terms of the mouth. Yeah, longevity.
Yeah, I totally agree with that. Thank you. Okay, so what skills do you think you need to become a member of the dental team? So we'll ask Chet that, if that's okay. What skills do you think a dental professional needs?
Olivia, you mentioned manual dexterity. I think that is quite important, regardless of which sort of field you go into in dentistry. I think it's important to be able to be meticulous, have that level of control of tools and things. It differs the amount that you need in the different professions, but I think it's important across the board. And people skills, it's always about whether it's dealing with patients, whether it's dealing with other members of your team, the ability to get messages across. Sometimes you've got to deliver, fairly sort of serious news. Sometimes you've got to deal with children, depending on the sort of the patients that come through the door. So I think that's really important. Your ability to just get messages across and have that personable sort of side. In dental technology, manual dexterity, I think, probably trumps the personal side of things, just because we're not dealing with the patient quite so much. But and the things that we're doing need high level of detail. If we're making a crown or a bridge, it's often really, really fine detail things that you're manufacturing. So I would say that covers the dentistry as a whole. Yeah, I think so.
Thank you. Does anyone else have anything to add to that question? What skills do you think you need to become a member of the dental team? I totally agree. I think the communication thing, you've got to be able to explain things to a patient who doesn't necessarily know anything about dentistry, and you have to explain it in a way that's clear and concise. Fab. Okay, I'm going to go back to the chat then. So my colleague Rebecca has just popped in the chat. In regards to clearing, I've just had a quick chat, and the only dental course available for clearing appears to be the BSc Dental Technology course, which is available at Cardiff Metropolitan. As Fiona mentioned, all of the courses are likely to have reservist lists due to the number of applications. Okay. The next question. Say you're unable to meet the requirements to get into uni. Can you reset and take a gap year and apply the year after? So we don't work for kind of Cardiff University, so it's hard for us to answer this. But does anyone want to take this? I'm happy to answer it if not.
I think Jenny Galloway did just say they don't take resits, didn't she, on her presentation? And I don't know a lot about it, Olivia. You probably know more than I do, but I think it does massively vary from university to university. Yeah. On a totally personal note, a friend's daughter did get into Liverpool with a resit in one of her A levels. So I think it depends on the year and it depends on the university as well.
Fiona, did you have your hand up?
Yeah, I was just going to say pretty much that it's based on each university and what their criteria are at that time. So, yeah.
Chat, at a hand.
And just to add, occasionally in dental technology, our applicants are perhaps people who didn't quite meet the requirements for dentistry. And so sometimes we'll get people coming to dental technology whose intention in the long term is to go to a more clinical role that they haven't quite met the requirements for initially. So clinical dental technology, dentistry. I think we get we get roughly 25 per year applicants. Not applicants, sorry, 25 per year students coming through from application. Probably around 5 of them right at the start are already suggesting that their intention is to then move through to dentistry. So it's another option if resitting and taking a gap year isn't an option for dentistry per se, but for your application, dental technology might be an option as well. And if you are applying for dental technology specifically, we will allow gap years and resits as well. So,
thank you. That's really helpful. Yeah, I would say I touched upon this, I think, in my presentation about that kind of 5th choice. So if you do want to go to, if you want to do the 5-year course or even the hygiene and therapy course, well, for the 5-year course, as I said, you can only apply for 4 options. So you have 5 university choices, but only 4 of them can be that 5-year BDS program. So that 5th choice can be quite important. So some people do things like pharmacy, hygiene and therapy, even though that's very competitive, or dental technology. And they have the view they will do the dental technology degree, knowing they then want to go and do dentistry after. It is quite common to have a degree before you do dentistry. I have a previous degree from before my dentistry degree. It is quite common. The issue is you have to fund 2 degrees then. But depending on what your first degree is, you can work during your dental degree. You know, if you're a qualified dental technician, you could potentially work to fund the next degree. To answer your question directly, and again, I don't work for university, I work for Health Education and Improvement Wales. So this is my opinion. I would, if you're resitting, you're taking a gap year, 2 things. I would be contacting the universities to find out, because you've only got 4 choices. And if one university has a blanket ban on anyone that's resitting, you're wasting one of those choices. So I would personally speak to an admissions tutor. I would go to the open days. I would ask them directly, email. So think about your choices really carefully. And also, if you are going to resit and you're going to have those 12 months, make sure you're doing something in those 12 months that's helping your application. The universities are going to look at your application, okay, they've taken a gap year, but what have they done? Have they worked full time in a dental practice? Have they done a dental nursing qualification? Have they done volunteering? You know, they don't just want someone who sat at home and done 1 resit to up their grades. You really need to improve your application to make you kind of competitive. That's just my opinion, but I did go to dental school and I know what it's like. So I hope that answers your question. Is there any extracurricular activities or opportunities that would be beneficial and improve chances of getting onto a dentistry course? Okay, would anyone like to take this question? I think we'll probably go to a few people because it would be good to have the answer to this, not just for kind of a dentistry course, but all the other courses as well. Catherine, I see your hand.
I suppose, yes, I think it's important that we all agree that it's quite a people profession, dentistry, no matter, even though, as Chet says, he's behind the scenes as a technician, but as a clinical dental technician, you'd be with patients. So I think I'd be thinking about, how do I communicate with people? What sort of experience have I got in caring, perhaps in some time management, because you have to keep to appointment systems in working in dentistry. So I'd think, yeah, have I got experience with working with other people? What have I done as a team, maybe playing a team sport or doing team things together? Also getting things done. Certainly as a dental nurse, you do need to get things done. As Meryl was saying earlier and Olivia was saying, you need to prepare. So I think I'd be looking for experience with, communicating, working with other people and achieving something as a team, an outcome where you all had to work together to get something successfully done.
Thank you. Anyone else want to add to that? So extracurricular activities and opportunities that would, Chat, from your perspective, someone applying to dental technology, you know, what would be a good extracurricular activity that would help their kind of application?
It's really varied. I think, Catherine, you've sort of covered a lot of it. One thing I was going to add, in personal perspective, I think photography as a kind of hobby would be a really kind of useful. It shows a lot of, there's lots of, you need a level of artistic kind of, nous there. So I think that's one thing I've really noticed. Anyone who plays any musical instruments, that sort of side of things. I I think that's really handy. Team sports, I think that, again, to support what Catherine said about that ability to communicate and work within a team. But photography is one I think that stands out to me, is for dental technology specifically. And yeah, I suppose in dentistry as well, there's clinical photography needed as well. So that'll be one.
I think anything with a degree of manual dexterity, like Chet said, musical instrument playing, anything artistic, maybe something like that. I know, I don't think they do it anymore, but they used to have manual dexterity tests, I think, on entry to dental school. I don't think that's part of it anymore, but if you can display that maybe in your personal statement, that may be useful, I imagine.
Yeah, I'd agree. Anything to add there?
No, I pretty much agree with all of that. Just this dexterity thing, really, if you can demonstrate. I mean, I'm not musical, so that's not one of my strengths, but I quite like crochet, and I quite like embroidery, and it's that fine art, kind of fine tuning of these dexterity skills. So yeah, anything like that.
And for people who do get interviews at dental school for for hygiene, for therapy or dentistry, a lot of people bring evidence of their manual dexterity to the interview. So I used to do quite a lot of painting, and I had like a sketch pad with painting, and I made sure it was quite kind of small and easy to bring to the interview, because there were people with kind of huge canvases of paintings that they brought, which is lovely, but in practice it's a bit strange. So I just had a little kind of A4 book that I just put on the table and said I did this, and they asked me to talk through the painting. I've done some kind of mosaics and things like that. There was a friend of mine who, she does baking and kind of intricate cake decorations. She had an Instagram page, and she said to them in the interview, look at my Instagram, so anything like that. I think those sort of hobbies are brilliant when you're doing your A-levels. It's quite stressful. It's really good to have that, start painting, doing something like crochet is really good to take your mind off your kind of the stress and your workload. But also it can be very beneficial to bring to the interview, to show that, just make sure whatever you bring is nice and compact and not kind of a huge canvas. Chet.
Yeah, just as you said it, I was thinking cooking. We had a student who was really interested in cooking, and there was a great hobby of theirs in baking. And I think it shows the ability to follow instructions, follow the recipe, but also be creative, So yeah, cooking is a really good one as well, I think.
Yeah. Fab. Okay, let's just go back to the questions. Would taking a gap year and applying with certain grades instead of predicted be preferred by the universities? This is a tricky question for us, because we're not a kind of a higher education. We're not a university necessarily, at HEIW anyway. Does anyone want to try and answer this? If you don't feel able, that's obviously fine.
I'm quite happy. I think, if you've got to speak to the universities, you've got to ask, give them a call, send them an email. They've got quite a lot, have live chats on their websites and things like that. That's the best way. Just be open and honest and ask the questions. And then, if that's what you plan to do and it's not acceptable to that university, you need to think whether that university is for you. And just, do your homework. We don't have all the answers, but we can point you in the place for to get those answers. And I think, find the school you want to go to, and then speak to them if you've got alternative plans.
Just to add from the Cardiff Met dental technology application process, if a student is applying with predicted grades, what normally happens is they will get a conditional offer, and the condition is based on then having the evidence of the grades once you receive them. So the question is preferred. I don't think it's preferred or not. It's just, if you haven't got the grade, you'll get a conditional offer. If you have got the grade, you may or may not get an unconditional offer. So the type of offer you receive is just different. So not necessarily preferred or not, I think.
Seems to be a quite a theme here of people interested in gap years and kind of having maybe they're a bit unsure about what they want to do. My personal advice would be, don't rush into anything, because university fees are very expensive, and you don't get them back once you've kind of started. So really think carefully. I personally don't think there's anything wrong with having a gap year in terms of kind of life experience. If I was a bit unsure and I didn't quite have the grades for dentistry, I think a great thing to do is to go and do a dental nursing qualification and say, I'm going to have a few years, I'm going to do dental nursing qualification, work in a practice, learn what it's like to be in the dentistry world, and then possibly consider applying to be a therapist or even a dentist. Once you're a qualified dental nurse, there's also things like orthodontic therapy, which is I've talked about in my presentation. I think that's a really up and coming career pathway. I think it's very varied. There's an interview with an orthodontic therapist on the Careersville platform, so have a look at that interview. But yeah, just don't necessarily think I've got to do that 5-year BDS program. I've got to get in within 12 months, because life doesn't always work that way. I came to dentistry a lot later on than the average person, and actually, in my experience, the universities see you as much, your application is stronger. If you have worked as a dental nurse for 2 years, it shows you really understand what it's like working in dentistry. And that personally, and this is just my personal opinion, I don't work for a university, but I think that will really strengthen an application. Fiona, hand up.
Yeah, just to say, from a hygiene and therapy point of view as well, previous experience in dental nursing is seen as you know, a positive, and it is part of, you know, your career into dentistry. So again, once you can start as a dental nurse, but you can, and I know many people that have ended up being dentists and moving on to that, you know, further. Saying that, within dental nursing, there's lots of ways you can go as well. So it's a great way to start if you are interested in dentistry.
Mm-hmm. And as a dental nurse, you can do the qualification and get paid at the same time. So it's kind of training on the job. You're still getting a great qualification. So yeah, just think about the options. I'm going to move on to a couple of questions I'd like to get through. So what are the job prospects for working in dentistry? So I think this question is, someone wondering, are there jobs out there? Chat, you've touched upon this in technology. Catherine, is it okay if I come to you? Job prospects in dentistry.
For a dental nurse, absolutely, yeah, plenty. As Chet said earlier, the dental workforce, all the people that work in the team, we're quite, I wouldn't say we're a profession in jeopardy, but we're certainly a profession that needs more individuals, both coming into the profession and to stay into the profession. So for a dental nurse, there's a lot of opportunities at the moment, both in a general practice or perhaps working in a hospital. There are many opportunities. You wouldn't be short of a job at the moment, yeah. Good prospects, yeah. with appropriate training and qualification, of course, yes.
Fiona, what about from a hygienist and a therapist perspective, job prospects?
Yes, so again, we've mentioned that applications are it's really competitive, because I think Cardiff trains 17 therapists and 13 hygienists a year. Bangor University are going to train 12. So there's not a lot going into the profession. So there's, a lot of people dentists wanting hygienists and therapists to spread the workload. And so, yeah, and a variety of settings as well. So, yeah, there's no shortage of work. Very fortunate, really, in dentistry that, we are able to graduate and actually be able to put our skills into practice straight away.
Yeah, I would totally agree. Okay, I'm going to move on. Meryl, I'm just going to ask you a little bit about orthodontics, if that's okay, because I feel like lots of people, even before they've trained to be a dentist, know that they want to be an orthodontist. So can you tell me the kind of the career pathway to training to be an orthodontist, how it works?
Yeah, so you initially do your 5 years dentistry, so you get your BDS, and then once you've qualified there, you need to then do a further couple of years to enable you to get your MFDS, so your membership of a Royal College. And that can take 2 years, it can take more than 2 years. And during that period, you normally need to show that you've done some jobs that are applicable to then going on to do orthodontics. So when I did it, they wanted some max fax experience, so I had to do on-call jobs. They also like you to have some PEDS experience before you get onto an ortho training pathway. Then the orthodontic specialist training pathway is a 3-year or a 5-year programme. So the 3-year programme enables you at the end of it to qualify as a specialist orthodontist. And that qualification is your MORPH exam, which you get from one of the Royal Colleges. And at that point, then you can go out into specialist practice or a community orthodontic programme and work as an orthodontist, treating relatively straightforward, some complicated cases. So probably a lot of you out there have had brace work with a specialist practice. And then if you want to become an orthodontic consultant, you need another 2 years of training. So you can either add another 2 years on, or some programs offer a 5-year training program, which is called a run-through training, where you don't stop after the 3 years and apply somewhere else. You just go all the way through. So essentially, it's 5 years of orthodontic training to be a consultant and 3 years to be a specialist.
Thank you. So quite a long...
Answers your question.
Yes, it does. Thank you.
To say, I suppose, as well, is that the way you apply for courses changes all the time. So when I did it, which was a long time ago, you just applied wherever you wanted to go. But at the moment, there's a process called central recruitment, which also applies to newly qualified dentists looking for jobs in hospitals and things, where you all go into a pool and you all go to the same interview, and then you rank where you would like to go from first to last, and then you as a candidate are ranked, and then they have a very clever system of matching the ranking to the places. So you are sometimes then required to go elsewhere to do your training. But that is changing all the time, I would say, and probably by the time you guys come through may have reverted back. I'm not sure.
Thank you. That's very helpful. Thank you. Before we go on to the last question, I just want to ask one question for Catherine, if you don't mind. I think we just haven't touched upon this. I think it would be helpful for people. How would you go about getting a job as dental nurse? What would you suggest? What advice would you have for someone?
So I think there are several different ways. I mean, you can get a job in a dental practice then, if you were to start in a situation where you would do workplace learning, which we spoke about earlier in the presentation. So you would find a job in a practice, and then that particular practice, that dental practice, would then get you on a training course. That's certainly the most appropriate way in Wales to train, because in the dental school in Cardiff, they don't train dental nurses. So they're trained in practice. So again, like Olivia was saying earlier, you would approach a dental practice. They would offer you a position as a trainee or a student dental nurse. You would be paid as you were going to college 1 day a week or half a day. And for the rest of the time, you would be a working dental nurse as a trainee. So best really to approach a dental nursing. You could have a look at jobs, as I say, within a dental practice, or also you could go to a careers event such as this, or a careers event that was running locally in your area. I know Cardiff do some as well. But probably your own dental practice, I would have thought would be a good place to start.
Fab. Brilliant. Thank you, Catherine. Okay, we're going to end with a question that I'm going to ask everyone, if that's okay. So this question is, what would be one piece of advice you would give to someone considering a career as a member of the dental team in Wales? So I'm going to go around the room, if that's okay. So we'll start with Chet. What would be one piece of advice you would give to somebody considering a career as a member of the dental team in Wales? One piece of advice.
I think for anyone who's in the position of thinking about what they want to do next, the most important thing for me at this point in my experience is just do the research. I think is make sure that you've done enough research and you're as aware as you can be. And so for those who are here now, this is a really great start if it's the first thing that you've ever experienced in terms of thinking about dentistry. When I personally started, I did very little. Luckily, it's ended really well for me, but I didn't know what I was getting into. So that would be my advice, really, for anyone who's thinking. Do some research, get out, do the work experience, and get into the world and see what it's like, and find out if it's really something you think you could see yourself doing for the next 40 years.
Fab, thank you. And Fiona, please.
It's really hard to pick one piece of advice.
It is. You can give a few if you really want.
I would say never say no to any opportunity that arises, because you never know where it's going to take you. That's my one.
Good advice. And Meryl?
Well, I had written down arm yourself with knowledge, which I think Chet has sort of said. And it's more from personal experience of watching friends, children trying to get into dental school to study dentistry, because obviously I did it a long time ago when it was easier to get in. Just tailor your qualifications and your experience to the places you're applying, because you don't want to waste any of your applications, because some schools will ask, I think Cardiff asks for an A in English, used to. So if you haven't got that, it's don't waste your application on things that you're not tailored to. And I would say be well-rounded. So be academic, but everybody is applying to these places as academic, and look after yourself and make sure that those hobbies that you've got allow you to have some time to yourself, look after yourself, and it will prepare you not only for your studies but for life in general going forwards, I think.
Good advice. Thank you, Meryl and Catherine.
Yeah, I think similar, really. I would just be curious. I would just ask a lot of questions. I would put myself, I think, what happened to me the last time I went to visit my dentist? What did that nurse actually do? I couldn't really see because I was lying back in the chair and I was listening to what Meryl was telling me as the dentist. But what was the dental nurse doing? So I think a bit of detective work, a little bit of nosiness, and then imagining yourself in that dental nurse uniform 5 days a week. So be a little bit nosy and curious and imagine yourself in their shoes, I think.
Yeah, good advice. Think, can I do this every day? I think really carefully, and consider the other roles in dentistry as well. I think some people do get a bit hell-bent on, I'm going to be a dentist and that's going to be it. And that's great, but there are so many other roles which offer an amazing career pathway. So hopefully we've shown that a little bit today. Anyone else have anything else they'd like to add? Any more questions? Please feel free to post them in the chat. Meryl, you look like about to say something.
I was just going to say that when just as an aside, is that when I did it, I just thought as a dentist you would sit in a surgery 5 days a week. I didn't realise the opportunities that were out there, and the things you can specialise in are so varied, and the roles you can eventually have are so varied, that it's really worth considering that, I think.
Yeah, I'd agree.
I didn't know when I did it.
Yeah, and I think that kind of, the dentist that we kind of know, we would go and have fillings at the dentist. Yeah, they do form, a large part of the workforce, but actually there's so many specialties in dentistry, and sometimes I think it's not as well, people aren't aware of it as much as they would be maybe of medicine. A lot of people apply to medical school, but dentistry is, in my opinion, a better career. It's better in terms of kind of work-life balance. We haven't really touched upon the hours that we would work, but it's actually very rare to work on-call hours in dentistry. In MaxFax, yes, but the most part you work 9 to 5. You can have a great family life. It's a good job, particularly as a woman and things like that. So yeah, please do consider life in dentistry. Thank you very much, everybody. We really appreciate the panelists in particular giving up your time for HIW. We really appreciate. Thank you so much for participating in this event. As I said, this will be this is recorded and it'll be available on our Careersville platform. So this is, if you type Careersville, HEIW, into Google, you'll see we have a virtual village, and there's about 7 different buildings at the moment. Each building represents a different healthcare profession. So we've got pharmacists, nurses, doctors, and now we have a whole building dedicated to dentistry and all the professions. So we've got interviews with dental professionals working across Wales, and videos and blogs and things like that. And yeah, so thank you very much for a lovely morning, and I think that's everything. Thank you very much, everybody. Take care and goodbye.